So I'm having today an earlobe reduction surgery. I'm having this because I'm very conscious about my ears and the skin around my ears. They're very long and they're split, as you can see, from years of wearing heavy earrings. So yeah, I'm getting married in August and just want the best hairdo and I want my confidence back. So that's why I'm here.
Nice to meet you.
Nice to meet you.
Yeah, so I understand you're booked for the earlobe reduction, right?
Yes, I am. Yes, I am.
Perfect. So maybe you can hold the mirror and show me what you'd like to have.
So here, as you can see, it's split. I would like the earlobe cut.
Yeah.
Just made smaller and obviously take that excess skin off.
Yeah, perfect.
Years of wearing really heavy earrings have made them really saggy. And you can see, obviously, there's quite big holes, split. Really conscious of it. Knocks my confidence. Would love to wear my hair up.
I'm Carlo. I'm a plastic surgeon. I did my medical studies in the Lebanon at the American University of Beirut. I did my general surgery training over there, and I did my plastic surgery training in Brazil, in Rio de Janeiro, with the legendary Professor Ivo Pitangui. And I spent 3 years training under his leadership. And after that, I spent 1 year in Switzerland fine-tuning my skills in facial aesthetic surgery and body contouring surgery. And the split is not a problem because it's a little bit, it's on the low side. So I can definitely remove some excess skin from the earlobe. It's going to look much smaller.
Love that.
But it will be natural.
Yes, smaller and cute.
And cute, yeah, absolutely. Yeah.
I'm here for it.
And I think the left one is a little bit longer than the right one, but everyone always has a small difference.
Okay, can we make them even?
Yeah, we'll do it as even as possible. Once we're inside, I'll do the drawings, take the measurements. Amazing. I'll start with the right side because it's the shorter one, and then we'll do the left and make sure they look very similar.
Amazing. I'm excited, yeah.
Yeah, perfect. So the procedure, it's quick. It takes around 20 minutes, 25 minutes to perform. And you won't feel any pain, just a sharp scratch, which is the anesthetic, and then maybe some tugging and some pulling.
Perfect. Let's go. So I've just had my surgery done. It was really fast. I think lip filler actually hurts a lot more and takes longer. The team made me feel so comfortable and I was so relaxed.